Good morning and welcome to Let's Talk. Thank you for joining us for this half hour. Now, let's talk.
And good morning and welcome to it. It is Let's Talk for 30 minutes. I'm Tracy Morgan. Nice to have you with us today. Today is going to be our day with Compassionate Care Centers, and we're talking about medical marijuana today. And if you have questions about your own condition, maybe if it's a loved one, if you're just wondering what is this all about, you're more than welcome to call us today because we have a doctor on the line that I'll welcome into the show here in a moment, and he's going to be with us for 30 minutes. And I love when this happens because it's a free call for you and it's a free question for you. I mean, there's no charge to any of this. So if you want to ask a doctor any kind of question about medical marijuana, today would be the day to do it in the next 30 minutes. So 283-2525 is our phone number, 283-2525. Now, the different ways that you can listen to us today, of course, you have us on the radio. You do have the app on your smartphone. You can download that for free. You can get us online, WISR680.com. You can get us on Alexa-powered devices. So all different kinds of ways that you can listen to our program while we're broadcasting live until 11:45 today. If you would like to listen to this program in its entirety after we're all done, give us a couple of minutes, and then we'll have it on our website at WISR680.com. And you would pick programs and then Let's Talk. And then you're going to see a special category there that we have. This is going to be in that special category. So look for that, and it will be Compassionate Care Centers with today's date. And Dr. Donner is with us today, Dr. Brian Donner. So that is your list on how you can listen. Let's get to it. So Dr. Donner is on the phone with me now. Dr. Brian, thank you so much for being here today. I know we've talked a few weeks ago, but it's nice to have you on because I still think that this is a conversation that people hear, but we just still don't understand what's going on with this.
Absolutely. Well, first, thanks for having me on again. I really enjoyed it the first time, and I agree with you completely. Typically, when you talk about medical marijuana, it's not something that we can get under wraps in just one conversation. So I think the more we can talk about it and really have some dialogue, the more comfortable people are, and the better it can work as a treatment plan. So I'm excited to be talking to you today.
Now, Compassionate Care Centers, you have a few different centers, but ours here in Butler is at 127 East Cunningham Street, so it's right downtown. But the thing that I find interesting about this is that it's physician-owned. And so I want to ask you how that came about, that physicians have gotten together to say, let's look at this alternative for medicinal purposes.
Sure. It's a good question, Tracy. Really, I think the origins of compassionate certification centers came out of myself and then a few other physicians or colleagues that I had worked with over time. And really, what we had found when we had examined some of the medical marijuana programs in other states is really that there was not a lot of clinician or physician support for medical marijuana patients. And oftentimes it was relatively straightforward for them to obtain their medical marijuana card or certification, but that they didn't have the ongoing support that they really needed for their treatment programs to be effective. So really out of that idea, myself, our CEO, Melanie Kachi, and a few other physicians, the idea of compassionate certification centers was born. And our goal is really to be a full-service medical marijuana healthcare organization for patients.
Now, with compassionate certification centers, you have a whole entire line of doctors, and they have different specialties, don't they?
Yes, that's correct, Tracy. So we have doctors that are board certified in many different specialties. So from emergency medicine to internal medicine, pediatrics, oncology, and all of our physicians are listed on the Pennsylvania State Medical Marijuana Physician Registry. So they are able to evaluate patients and help them obtain their medical marijuana certification.
So is there a shift? I should ask that first. And if there is a shift in this, what's behind the shift in doctors opening up to the idea of maybe alternative health options? The reason I ask that is because we've talked to many different professionals on this show, and doctors are wonderful people. You're full of knowledge, and then sometimes the alternative medicine world isn't really necessarily in your lane, if you will. Is there a shift where doctors are opening up to seeing both sides of the coin?
Yes, you're absolutely correct, and I'm glad that you brought this up. What's unique and interesting when you look at medical cannabis and the movement, particularly in our country, it's very different than traditional or modern medicine. Classically, I think different treatment plans are initiated from clinicians like myself, or researchers, or healthcare organizations. Medical marijuana is really different in that it's been a patient-driven movement or focus, and rather than be initiated from the clinicians like myself, it was initiated from a patient level. I think this, in and of itself, is a very powerful thing, and it shows a paradigm shift of healthcare, not only with medical cannabis, but really all of healthcare in our country, where patients are taking this more into their own hands, and I think it's really a great thing. So I think that's a large reason why you see some of the differences in medical marijuana. And I think rather than go from the doctors down to the patients, it's gone reverse. It's from the patients up to the doctors. So that may be part of the reason, at least, why the physicians may have been slower to take on medical marijuana.
Even though you say that this has come from the patient's desire, if you will, have you had many patients come in and still be a little shy that they're in the doctor's office for medical marijuana?
Yes, most patients are very shy and a little bit apprehensive when they come into our office, and the reason is really just because they don't know what to expect. And really, what I try to tell my patients, particularly at our office, is we function just like any other healthcare provider or physician's office. So whether you went in to see your primary care physician or your orthopedist or your neurologist, we just have a focus on medical cannabis. So part of whenever patients come to see us is helping them get more comfortable, as well as a better understanding of medical cannabis, and not only the medicine, but how the state program and the regulations run.
Now, one of the things that you do at Compassionate Certification Centers is help people get their card. Can you walk us through that process? What do we expect, and how do we go through the steps of getting our card?
This is another question I'm glad you asked, Tracy. The process can sometimes be a little bit cumbersome. So really, I guess the first thing I tell people is that they need to have one of the 21 qualifying conditions in order to obtain a medical marijuana certification. A list of all these conditions can be found on the State Department of Health website, which is really a good starting point for patients. Once they have determined they have one of the qualifying conditions, then the patients need to register with the State Department of Health and the Patient Medical Marijuana Registry. This process is done online, and if patients are having difficulty, organizations such as ours or the Department of Health can assist patients in that registration process. Once the patient has been registered, they then need to see a physician who is listed on the State Medical Marijuana Physician Registry. There's about 1,000 doctors so far across our state, and there's a complete list on the Department of Health website if patients need help finding one of these physicians. Following that, the patient comes in, they have an encounter with one of the physicians, just like any other doctor-patient encounter. Assuming things are appropriate, the patient is then certified for medical marijuana by the physician. They will receive a medical marijuana identification card in the mail, at which time they can then take that to the dispensaries, which is where the medication is actually dispensed, and they will also meet with the dispensary pharmacist at that time. So that's just a general overview of sort of the registration process. I always encourage patients, if they have any questions, they can simply pick up the phone and then contact our office or the Department of Health, and we can help them walk them through that process.
Dr. Donner, we had a story here in our office, since we do a lot of news here with our radio station, and it was talking about some other conditions being considered, possibly. And so, of course, I can't say they're confirmed to be on the list, but how do conditions end up on the list? And do you think that any new conditions will be added to the list of qualifying medical conditions?
Great question again. So I guess I'll start off and say that I absolutely think that there's going to be further qualifying conditions added to the list. With regard to the process, I think Pennsylvania has been very good in the process they put together to add new qualifying conditions. The state has put together a medical marijuana advisory board, which is composed of physicians, researchers, patients, other clinicians, and industry leaders, and they meet periodically, and they will take feedback from not only doctors and researchers, but also patients about a particular conditions, and then they'll look at the research supporting it, goes through a process, and then they can recommend adding new conditions to the Department of Health and then Dr. Levine. So a good example of this is really just what recently happened. The Medical Marijuana Advisory Board had met, and they voted to add some qualifying conditions, specifically to add Tourette syndrome as well as anxiety. This was signed off by the Medical Marijuana Advisory Board, and it's now sent to the Department of Health to be signed off at the physician level, which is basically the highest level, and then it can be initiated into the medical marijuana program. This was already done once earlier in the program, for example, whenever we added opiate addiction substitution therapy as one of the qualifying conditions. This will be an ongoing process, and conditions will continue to be added as appropriate over time.
So do you think that it's a guarantee that those two conditions will be added, or will there be any discrepancies, or does the second round of decisions, do they go through their own qualifying process for these conditions?
Sure. Tough for me to say for sure, but I guess I would put it this way, that the advisory board met, and that was their decision to approve those conditions. Really now it goes to the Department of Health for a little bit further research and then for it to be signed off on. I can tell you this, that I personally would be very surprised if those conditions were not initiated and enacted fully. However, I can't speak for some of the other physicians, obviously, or the Department of Health. But typically, when we've seen this process in the past, the recommendations made by the advisory board have subsequently been initiated into the regulations and state protocols.
Dr. Brian Donner with us, Compassionate Certification Centers. Our office here in the Butler area is 127 East Cunningham Street, and I say our office because there are many different locations around the country, and so if you would like to be a part of this, if you would like to get in contact with them, then please do so. You can't miss the building. It is well decorated on the outside. Compassionate Certification Centers on East Cunningham Street. And Dr. Donner, let me ask you about the medical marijuana itself. I'm going to kind of go backwards because I do want to know why we don't feel high whenever we are taking it. But let me start at the end result, if you will. Is this a part of healing the body, or does the medical marijuana becomes more of a maintenance plan?
So wonderful question, Tracy, and my answer would be that it can be both. I think that we've obviously found through research that certain groups of symptoms that patients have, medical cannabis can be very effective in treating them. So, for example, maybe it's chronic pain, maybe it's muscle spasm, so really treating the symptom itself. Alternatively, we're doing more research now to see that if medical cannabis can really go to the root cause of the problem. So, for example, in maybe a child with a seizure disorder, is it helping the neurochemical communication process that's happening? So to answer your question, I think it can fall on both sides, that not only can it help from a symptomatic standpoint, but it can also help to potentially correct the underlying issue, or to help your own body correct that moving forward.
So when we have the medical marijuana, are we feeling any different while we are taking it? And I ask that because that leads into the question of why don't we feel high when we're taking medical marijuana?
Yes, and it can get a little bit complicated, but the way I explain this to all of my patients is that all human beings, and in fact all mammals, are born into this world with an endogenous endocannabinoid system. So this is a system of biochemical communication where you have some receptors and chemicals that either bind to these receptors or act around them and then elicit a physiological response. This system works very similar to other biochemical systems in our body that we know very well, such as serotonin or dopamine or norepinephrine. And when you look at actual medical marijuana and the active ingredients within the plant, they are largely partly what's called cannabinoids. And the most famous cannabinoid that everybody knows of is THC. Another popular cannabinoid nowadays that people hear about is CBD or cannabidiol. There's over 100 of these cannabinoids that we've discovered already and likely to discover more. But each of these cannabinoids has their own physiological effect. So, for example, we know that the psychoactive cannabinoid is THC, but that it also plays a role in appetite stimulation and analgesia or pain control. Conversely, we know different cannabinoids such as CBD. We know that it's a very potent anti-inflammatory. It can help reduce anxiety, and it can help with nausea. So when a patient goes to the dispensary, not all medical marijuana is created equally. And based off of these different cannabinoid profiles, we can approach different disease processes and symptomatology. And with regard to the psychoactive component, really that is just based off of the amount of THC that is in these medical cannabis products. So by controlling that amount, we can control or limit or eliminate the psychoactive properties of medical marijuana.
When you talk about not all are created equally, I'm going to ask this question, and I'm not sure if I'm correlating this correctly. I'm going to go to supplements for just a moment because I've had many conversations with holistic specialists, and they say that some supplements aren't created equally. So we'll just say like a vitamin C. You know, if one vitamin C is created one way, it may not come up to standards the way it should be for a full potent vitamin C. If that's the case, is that what you also mean by medical marijuana, that it's not all made equally? Is some not meeting some standards, or what exactly do you mean by that?
Sure, and I'll be happy to clarify. I think when I say not all medical marijuana is created equally, what you look at is each species of marijuana is genetically has some type of differences to it. And based off of these genetic differences, these can affect the different cannabinoid profiles that are within the plant. So although they're all cannabis, they all have slightly different endocannabinoid and terpene profiles within that plant, and different patients can respond to different profiles. With regard to the other end of the question and more of the testing standpoint, one of the great things about Pennsylvania's medical marijuana program is the stringent testing rules. So really there is what we call a seed-to-sale program. So every product that a patient gets from a Pennsylvania dispensary has been lab tested on multiple levels. It's confirmed, and this is readily available to the patient as well. So that anytime a patient is obtaining a medical marijuana preparation, they know exactly what is in it, exactly what is not in it, and at what ratios or so. So Pennsylvania has done a very good job of eliminating some of that discrepancy out of the medical marijuana program.
Doctor, I think we have somebody on the phone with us. I want to make sure that we can get them in if we can. Are you with us here on Let's Talk?
Yes.
Yeah, what's your question? The doctor's on the other line.
The fact that it's regulated, the medical marijuana, and he has all this system in place in the state. What happens to his organization if Governor Wolf gets his way and we become recreational? What goes on with all the good work that these doctors have done if anybody can get it now?
Well, this is a great question, and thanks for calling in and asking this. This is a question that we get all the time. And really what I tell people is what's going to happen to our organization is we're going to continue to do what we support patients from a medical standpoint. When you look at the population of Pennsylvania at about 12.4 million people, even if cannabis does go recreationally, all of these medical patients will continue to need support and guidance through their treatment process and program. Compassionate certification centers will be present throughout that whole entire process. And one of the things that we've seen in the past is that when you look at other states, and Colorado is a perfect example, they have a thriving recreational and a medical marijuana program. Oftentimes what will happen is that there'll be some delineation between the two. So, for example, in Colorado, patients have access to specific types of medications, maybe medications with different potencies, as well as different routes of administration, that patients who are just using cannabis on a recreational standpoint don't. So really, to answer your question, sir, what Compassionate Certification Centers will do is we'll continue to support patients and really focus on the medical end, because no matter what happens, whether it's recreational or not, the medical need for those patients will still be present and likely even at a greater level.
Again, the phone number is 283-2525. If you want to ask your question, now would be the time to do that, because we only have about 10 minutes left with Dr. Donner. And he's with Compassionate Certification Centers, and our center is in downtown Butler at 127 East Cunningham Street. And not only do they see you as a patient, they will help you get your card and go through that process and then figure out what you need to do next. And so, Dr. Donner, whenever you do go through that process, and you mentioned in that process you would take your card to the dispensary and you go from there, do we need to get a script from one of the doctors to tell us exactly what product we need and the amount and the strength and which form we're getting it in? Or do we just take our card and go to the dispensary and pick out what we want?
This is a great question, Tracy, and it's one that often brings a lot of confusion, not only with patients, but with clinicians as well. So because of the difference in state and federal law, we as physicians do not, quote, write a prescription for a patient. Rather, what we do is an evaluation and make an attestation that the patient would be qualified for medical marijuana. Now, technically, per the guidelines, there's the patient, when they go to the dispensary and they meet with the pharmacist, will discuss with the products at that point, and then a product will be recommended. However, when you look at how the guidelines are written, it's actually up to the patient ultimately what medications they decide. So what you will see a typical process will be is that a patient might come into our office, go through the evaluation and certification process. They're seen by our clinicians, and rather than write a prescription per se, what our clinicians will do is make a recommendation to them with regard to potentially the ratio of the product, the route of administration, and the frequency. And then our patients, when they go to the dispensary, will also discuss that same treatment plan with the pharmacist at the dispensary to reinforce it and to confirm those products are available. Then at that time, the products can be given to the patient or purchased. But ultimately, it is the patient's decision what products they decide to use, even if they're given guidance by the physician or the pharmacist. And this is very different than traditional medicine. So obviously, sometimes it's hard to grasp initially.
So are you saying that there is a limit or there is no limit that the patient could purchase once they're at the dispensary?
There's absolutely a limit, and typically what the limit is done by is everything is tracked. So what you will see is when a patient goes into the dispensary and they purchase medication, they will scan the patient's medical marijuana ID card, and then there is also a barcode on the back of the medication which is scanned as well. That then links that medication to that patient. So what the Department of Health and through the electronic systems, what they do is they can monitor the patients and how much they are purchasing. There is a limit that is a per month limit. To be frank with you, most patients don't even come close to approaching that, but is absolutely monitored and watched, and a patient just can't go in and continuously buy as much medical marijuana as they want.
Dr. Donner, I think we have somebody else on the phone with us. Are you with us on Let's Talk?
Yes.
Yes. So go ahead and turn on your radio, and the doctor's on the line. Go ahead and ask your question.
Okay. My question is, what is the difference between like the CBD oil that you would get through the medical dispensary versus those that the health food stores or the naturalistic stores are selling?
Yes, another great question, and thank you for asking, because this is another point of significant confusion. So really the difference when you get to as basic as could be is that when you go to an apothecary or a healthcare store and you buy CBD, that should be what's called hemp-derived CBD. So it's derived from the hemp species of cannabis. And by default, what that means is that that plant is very, very high in CBD and very low in THC. Based off of the updated Farm Bill or Farm Act, hemp is now legalized, so deriving CBD by itself from the hemp plant is essentially considered legal. Alternatively, whenever you look at the preparations that are purchased at a dispensary, these are what we would refer to more as a full-spectrum medical marijuana product, meaning that not only do they contain CBD, but they contain a broad spectrum of cannabinoids, and in particular, they will likely have a THC component in there as well. These products at the dispensary are derived from the female marijuana plant or flower. So really, that is the big delineation. Any CBD products that you see sold, let's just call over the counter or at a normal health care store, are hemp-derived. Any products that are sold at the dispensary are derived from the female marijuana plant.
Caller, any other questions for the doctor?
So is one more effective or, better than the other?
Sure. So I would say that one is not necessarily better or more effective. I think it really depends on the individual and what the goals of treatment are. When you get down to it, really the over-the-counter, if we call them CBD products, they're just focused on CBD, that cannabidiol and that specific cannabinoid. So for things such as stress, anxiety, reducing inflammation, a CBD-only preparation may work fantastically. conservatively, some patients may require more of a broad spectrum cannabinoid profile. So not only CBD, but maybe a small component of THC, a small component of CBG, and some of the other cannabinoids. So really it depends on each individual patient and what you're trying to treat. Usually what I will tell patients is that hemp-derived CBD is a very gentle and easy way to start off with a medical cannabis therapy, particularly because you don't need a medical marijuana certification. If they don't have any results from that, then we can obviously do a further evaluation and see if they would benefit from a more full-spectrum product.
All right, caller, thank you so much for joining us.
Great.
All right, you have a great day. And doctor, I want you to stress, if you could, the importance of seeing a doctor, because the caller's questions are really good, but that if I didn't see you, a specialist, a doctor, I'd still be in a guessing game.
That's absolutely correct, and it goes back to the first caller's question about what will happen when things go recreational. So really, medical cannabis is one of these fields that we're just learning an exquisite amount about, the research it's developing every day. And as I said before, Tracy, it's not a one-size-fits-all type of treatment. So there's different cannabinoid profiles, there's different routes of administration, and each person is different and with a different symptomatology. Really, if you're using cannabis medicinally, it's very important to have somebody who's experienced with medical marijuana to help guide you on your treatment program. Many patients, when they start a medical marijuana program or treatment plan, won't get the results they want right from the start, and it will take some finesse and tweaking to that to get to the point where they're satisfied with those results. This is really something that should be guided or at least done in conjunction with a healthcare provider who has some experience with medical marijuana, so that patients can get the most effective and most complete treatment out of this medication.
If you have a last-minute question, folks, and you'd like to ask Dr. Donner, we can squeeze it in now, but that would be it because we're really running out of time very quickly. But it's 283-2525, 283-2525. And this is Dr. Brian Donner. He's with Compassionate Certification Centers, and we have our location, or they have the location, right here in Butler, 127 East Cunningham Street, Suite 101. And the reason why I say we have ours in our area, we kind of claim things, don't we, Dr. Donner? Because you have many different locations that are around the area. You have your base in Pittsburgh, if you will, for our area, but then different locations within the country. Is that correct?
Yes, that's correct. And really, I am from Pennsylvania and from Pittsburgh. I grew up in the North Hills. So it was really important to us personally to get our offices and up and running in Pennsylvania and really to support the Pennsylvania program first and foremost. But as time has gone on, absolutely we'll be expanding, we'll likely be integrating telemedicine into our platform and practice as well, so that really we're able to reach more patients so that they will have this treatment plan available for them. So we're super happy to be in Butler. I think with the dispensary in Butler as well, there's a really good community base and support there too. So it's one of our busiest locations, and we couldn't be more happy being right where we are in Butler.
And you can't miss the building, folks, when you're going down East Cunningham. It is well decorated on the outside. So it's 127 East Cunningham Street, Suite 101. It's Compassionate Certification Centers. You might see the logo before the name, but this is the same building. So if you want to get a hold of the folks there, I'll give you the 888 number. If you want that one, it's 316-9085. So 888-316-9085. If you're looking them up online, it's CompassionateCertificationCenters.com. And Dr. Donner, before I let you go, last question, just your final thoughts on our discussion today, because I know one of the goals that you and your other doctors have is to educate people. So I'm glad you were here today, but what's your final thoughts that you want to leave us with?
My final thoughts are just to really have patients talk to people about this. So stop into our office sometime. You can talk to our managers, our nurses, our physicians, and then also talk to your family member and friends. People are always so surprised whenever they talk to family, friends, colleagues about medical marijuana, because typically what comes out are these stories of that really how patients have benefited. And I think that whenever folks can hear that from a loved one or someone that they know or trust, it can make a big difference. So don't be shy about medical marijuana. It's really a fantastic potential treatment plan for patients, and just continue to ask questions as much as you can.
Compassionate Certification Centers, of course, again, 127 East Cunningham Street right here in Butler. Dr. Donner, thanks so much for joining us today.
Thanks so much, Tracy. Always a pleasure. Have a great day.
You too. And folks, thank you very much for joining us as well. Of course, this will be our podcast of the day. How you get that is WISR680.com. Go ahead and pick programs, and then Let's Talk, and you can go from there. Thanks so much. I'm Tracy Morgan with Let's Talk.
The information and opinions shared on this program are solely those of our guests and do not necessarily represent those of WISR, the Butler County Radio Network, or its staff and employees.